Assalamualaikum warahmatullahi wabarakatuh. I am Khairul from ITD S21. I'm going to present about my project titled Clinic Appointment and Patient Record Management System. Many clinics still use manual systems. Manual methods often cause mistakes. So we need digital solutions. So this project will create a system to manage appointments and patient records more efficiently. There are several objectives for the system. First, to design a system that enables patients to book, cancel, and reschedule appointments. Second, to create a secure digital repository for data storing and data retrieving. Third, to provide clinic staff and admin with tools to manage schedules, patient data, and service reports. So there are two different separated scopes in this project. So first, modules to be developed. There are plenty of them. And second, target users. So there are two, which are admins and also patients. There are 11 total of our business rules. So first, a patient may have 0 or 1 active insurance, and an insurance provider can cover multiple patients. Second, every doctor must be assigned to one clinic, and one clinic can employ one or more doctors. Third, an appointment must be scheduled for one patient, and one patient can have multiple appointments. Fourth, an appointment must be assigned to one doctor, and a doctor may have more than one appointment. Five, a medical record is created only when a patient visits, and an appointment may have zero record if the patient never visits. Six, every medical record belongs to one patient, and a patient can have many medical records. Seven, every medical record must be altered by one doctor, and one doctor can alter many medical records. Eight, a prescription can only exist as part of medical record, and one medical record may list multiple prescriptions. Nine, every bill must reference a patient, and a patient may have multiple bills. 10, each appointment generates at most one bill, and no bill created if appointment is cancelled. Last, a doctor can have multiple specialization, and a specialization can be shared by many doctors, and a doctor must have at least one specialization. So based on all the business rules I've mentioned before, this is the ERD. This ERD contains 10 tables, which includes one bridge table and 9 normal tables. Next part is data dictionary. So this is the data dictionary for patient table. This is for the doctor table. This is for the appointment table. This is for the bill table. This is for the medical record. This is for the prescription table. These are for specialization and doctor specialization tables. Second last is for the insurance table. And the last one is for the clinic table. So the next part is for the data definition language. So DDL statement for insurance table and clinic table are like this. Next, these are the DDL statement for patient table and also for the doctor table. Next, these are the DDL statement for appointment and also bill table. Next, these are the medical record DDL and also prescription DDL. And last, these are the DDL statements for specialization table and also clinic table. So next part is for the data manipulation language. So first section is for the insertion. So each table we inserted 5 different values. So these are 5 different values inserted into insurance table and also clinic table. For the doctor table and also patient table, both are inserted with 5 different values as well. For table appointment and also bill table, both are also inserted with 5 different values. For medical record table and also prescription table, both are inserted with 5 different values as well. And lastly, for table specialization and doctor specialization, both are also inserted with 5 different values. So these are the screenshot of tables with data. So table insurance obviously have 5 different values, and table clinic also have 5 different values. Next, for the table doctor and table patient, both of them have 5 different values as well. For table appointment and also table bill, both of them also have been inserted with 5 different values. For the medical record table and prescription table, both are also inserted with 5 different values. Lastly, for table specialization and doctor specialization table, both also have 5 different values. So based on the project guideline, I have to add a minimum of 3 SQL queries for updating data. So first SQL is update patient phone number. Second, change status of appointment 1 from scheduled to completed. And third one is mark bill 3 as paid and sets the payment date. So based on the project guideline, I'll have to add a minimum of 3 SQL queries for data deletion. So for the first query, delete a prescription, easy. For the second query, delete only if appointment for was previously marked as cancelled, delete where appointment equal to 4 and status is equal to cancelled. And third query, delete a patient record. Make sure to delete related data from appointment table, bill table, and medical record table first before proceed to delete a patient record. Okay, so for the selection and projection topic, I have two select queries. So the first one is to select patient who are female and born after 1990. And from the output, I have only one output, which is mailing, that is female and born after 1990. For the second one, for selection and projection, I need to select clinic names and phone numbers only. This is easy. From the output, I'll have clinic names and also clinic phone numbers. Okay, for the next topic, which is aggregation and grouping. So first, SQL query, I want to count number of appointments for each doctor. So I'll have the doctor ID and also total appointments. For the second one, I want to have the total billing amount per status, unpaid, paid or pending. So I need to group by status. So we have pending for the total of 110, unpaid for 100, and paid for 340. So for the joint operation, I need to get patient names and their appointment date. So this I use join on operation, join patient ID from table patient and also with patient ID from table appointment. So we'll get 5 different data. For the second one, I want to get doctor names and clinic names they work at. So I need to use join on operation. I need to join clinic ID from table doctor and also clinic ID from table clinic. So we'll get the first name, last name, and also clinic name. So next topic, which is set and nested query. I need to find doctor ID that appear in both appointment and medical record table. So this we just use the intersect operation. So we intersect doctor ID from appointment and also doctor ID from medical record. So we will have the all doctor five all 5 doctors that are intersected. For the second query for set and nested query, I need to find patient name who have bills related to appointment with Dr. ID is equal to 2. So from the output, I'll get only Aisha. So I've separated the conclusion by 2 parts. First part is for the system contribution. So the system digitize patient information, appointment, billing, prescription, and medical records into a centralized database. So this system minimize manual paperwork and reduce the risk of data loss or data duplication. So this system enables quick retrieval of patient history and billing information. And the system integrates doctor specialization, clinic details, and also patient insurance data. So for the system drawbacks, part 2, this system relies heavily on stable technical infrastructure. And next, there are high risks of database corruption. Next, staff may struggle without proper user training. Next, this system raises data privacy and security concerns. And this system have high initial costs.